Quick little lecturette just to wrap things up. Probably will not post anything week 15. If I do, it will be just a wrap up. And that's kind of what this is. This is going to be short and sweet. It has to do with where this sexual therapy business is, where it came from, sort of, and then where it's headed. Not in great detail, because most of this is common sense, and I'm thinking that probably most of you guys would know this anyway, particularly you who are interns. I don't know how much of this you've dealt with as interns, but you will recognize the information here. So let's get with it and get it over with. Primarily, we talk about sex therapy in a way that distinguishes that from other types of psychotherapy. It's becoming a specialty area out of necessity, I guess, and it's kind of already there anyway. But I would think future it's probably going to be more distinguished in terms of maybe even you get a degree with it. You can now, but maybe there will be an actual exclusive curriculum for it. So we'll wait to see how that plays out. But it's basically designed to treat sexual dysfunction for anybody that's going through that sort of thing. Now, if you were to enter into this field, then you have to master a lot of things. And I don't know that that's part of the reason why there's such a lack of people who want to practice sex therapy. The ideas that you've heard already this semester sort of hinge on the comfort level. And I won't discuss a lot about that, but I'll mention it again in a few minutes. So let's look quickly at where this comes from and how it's evolved so far. We have to start with Masters and Johnson and their little awakening, if you want to call it that, of a discussion of sexual things. And if you recall, this was what, 60s maybe? I would have to look back and look at the dates. But nonetheless, it began as a behavioral approach, and it was designed to treat certain sexual problems. It didn't cover the whole universe. And then Kaplan came along, and he piggybacked on to Masters and Johnson's behavioral approach with a psychodynamic perspective. That's a Freudian kind of a base thing, psychotherapy, personality stuff, etc. And then Weeks in the 80s combined sex therapy with family systems theory. And he wanted people to, his shtick, is a Jewish word, by the way, was to combine sex therapy with family systems therapy, or family systems theory, excuse me. So you want to, according to him, you want to examine underlying relationship dynamics. And then from that, try to draw out contributing factors to the problems. And then later, therapists who are not really named per se, it's kind of a group, they began to describe I think describe maybe is the wrong word. They began to use cognitive behavioral therapy and solution focused therapy, narrative therapy, somatic therapy, and emotion focused therapy. All these therapies that were in existence already. Sorry, my computer bounced. And kind of put this into the spotlight by doing that. So this evolved, and again, I apologize. This thing's not on a good in a good place at the moment. This evolved into the use of Bronfenbrenner's theory about personality, etc. His ecosystem approach, and taking that and applying it, not personality, developmental, taking that and applying that to sexuality. So interaction among the systems, that's Bronfenbrenner's kind of emphasis. So what are we facing now? Well, inclusion of Bronfenbrenner ideals, and then the more involvement with pharmaceuticals. People who are having certain sexual problems that are treatable, or at least attempted to be treated using medications, and that can be troublesome, as you know, having been this far advanced into the study of psychology. Our paradigm is lack of medicine. We're not really interested in treating symptoms per se. We want to get to the root of the problem and thus treat the problem, which takes care of the symptoms. And I'm sure you've heard that ad nauseum through your psychology career. So that's what we're really interested in. And then to wrap it up, if you're going to do this, if you're going to get off onto this new area, if you want to call it that, then you have to understand that these are not new problems. They're rather rampant problems, talking about sexuality problems. And you need to be educationally prepared to handle these things. In other words, that gives rise to the specialization idea. You can refer cases. This is basic counseling here. Specialize in the area, knowing that if you run into a situation that you cannot handle, at least based on your own assessment of your abilities, then you refer. So why I bring that up, because that gives an opening to you. That may be something that you didn't think of, although you may have considered a degree in with an emphasis in sexual therapy. So there's more education to be had. There's more discussion to be had. I think it's probably for some an exciting area. I can assure you it's wide open. If you're looking at it from the standpoint of the good part where you help people, you can also look at it from a practical standpoint. Job market's wide open. So keep all those things in mind. And if I don't see you again on this medium, then I hope you enjoy the class. But most likely I'll give you a little wrap up next week, and probably see you then.